Chances are you did this last night in bed. This demonstrates what happens to our facial tissue when we sleep on our faces. This is an upward view through a transparent pillow. So the question is your beauty sleep aging you? Age, genetics, lifestyle choices such as sun exposure and diet and smoking determine the quality of our skin as it ages. So is this what causes wrinkles? Here is the myth about wrinkles. Hours of sun exposure, or our parents' skin quality, or even our age, these do not create wrinkles alone. In fact, there must be an action on our skin to cause wrinkles. Expressions such as frowning, squinting, smiling is one action, a deliberate muscle contraction. A lesser known action is compression, such as what occurs when we are sleeping and pushing our faces into a solid object, such as a pillow every night. Our sleep habits causes the wrinkles. The sun, genetics, natural aging, and lifestyle choices only set the stage for these two actions to create the wrinkles. So let's talk about the first action that causes wrinkles. That's years of facial expressions. Here's a picture of a classic forehead expression wrinkle. Over time, these lines will become permanently etched with repeated muscle use. We can treat these with neurotoxins. This is a typical frown expression line in between the eyes and the eyebrows. And again, a typical dynamic or expression line with squinting or smiling. Dr. Richard Glogow, an American dermatologist, created a wrinkle scale to document wrinkle severity. He said that sleep wrinkles cannot be improved with Botox because contractions do not cause them. He says that sleep wrinkles have been around as long as there have been pillows and people sleeping. Now the second action, the years of bad sleep habits with the compression of our faces against our pillows as we sleep. Limited attention has been given to this premature aging of our faces. In Kim's training company, where she was teaching doctors and nurses across North America on injection techniques, she saw facial lines and facial imbalances on thousands of her patients and herself. Note wrinkles above her right eye. These lines are sometimes single or two or three in a row, and this is caused by Kim sleeping on her right side. Caused by the repeated action of pushing her face into her pillow at night, like this. This is a great way to demonstrate by showing the compression and the shift of the tissue while she's sleeping on a transparent pillow. Notice the telltale signs of sleep lines. They're more vertical than expression lines on the forehead here. This is the first study available that demonstrates what we are talking about. Sleep creases were first described in 1987 by dermatologist Dr. Samuel Stegman, who is demonstrating his findings himself in this photo. He drew a connection between our superficial muscular aponeurotic system to sleep wrinkles. Our facial muscles are tethered to our skull in several locations. Pushing our faces into our pillows at night causes a shifting of the muscles and skin across the system. Dr. Stegman routinely told his patients which side they slept on. In 1999, Dr. Fulton confirmed this study. He warned against filling sleep lines with facial filler, as the facial creases will reappear within hours of treatment because the sleep habit that created the lines continues unchanged. This study done at a research hospital in Turkey reiterates that sleep lines are different from the lines caused by expression or aging. Sleep lines are a result of a physical habit, sleeping, and most people do not realize they are avoidable. Note the difference in the lines in this diagram. On the right, expression lines on the forehead, cheek, crow's feet are caused by muscle movement. Sleep lines on the left side are caused by pressure of our face into a pillow, more vertical and more diagonal in nature. So to summarize, here are the two forces at work every night and causing sleep lines on our faces in the morning. Compression, the downward pressure caused by the 3 to 5 kilogram weight of our heads, and tissue shift, which occurs as the skin and facial muscles are displaced by the friction against the pillow. The following pictures identify different sleep lines that are commonly seen. This 50-year-old patient habitually sleeps on her right side due to a chronic left hip pain. She has developed a unique yet slightly obvious line on her lower face. These Hollywood actors are not immune to sleep lines either. Dr. House has a very visible sleep line down his cheek, and Hannibal Lecter looks even creepier with this prominent forehead vertical sleep line. This 60-year-old patient has a sleep line just in front of their ear. It's obviously not a dynamic line. These lip lines are often confused with smoking or expression lines, but are tissue shift related. This is an interesting picture. This demonstrates how sleep lines and expression or dynamic lines can blend. The sleep lines in this photo are crisscrossing with the expression lines. When these expression lines are treated with neurotoxins such as Botox, the patient will often complain that they still have wrinkles, or that the injections caused new wrinkles. Caution must be taken when relaxing dynamic or expression lines so as not to emphasize the underlying sleep lines. These enhanced mellomental folds and lip lines are caused by a chronic right-sided sleep position. Dr. Stegman's early work introduced the hand test to help determine the future appearance of sleep lines, as well as to confirm that these lines or wrinkles he was assessing were caused by true tissue shift. Dr. Stegman would use the hand test to assist in understanding sleep line formation. As you can see, the first picture shows the effects of nightly tissue shift in creating sleep lines. These lines can be filled but will only return if sleeping position is not changed. The second picture demonstrates the hand test and how these lines will progress with nightly pressure. Here's another mixed picture of dynamic lines or expression lines with sleep lines. The hand test on the right demonstrates the impact uncorrected sleep positions will have on these lines over time. The hand test accentuates the periocular lines, as well. Notice the vertical crease above the ala of the nose. The hand test here clearly shows how this sleep line will progress over time if the patient continues to bury her lower face into a pillow. So the age-old problem is the way we sleep every night. And many of us sleep just like this. As you can see, 75% of the population sleeps this way and unwittingly puts pressure on delicate facial tissue. So let's see how sleep wrinkles can progress and prematurely age us. Sleep lines usually start around the eyes and above the eyebrow, depending on how we position our heads on our pillow. As we age, these lines become more prominent. Above the lateral brow, extended crow's feet, lip lines, mellomental creases all add years to our faces. These creases deepen, the skin pigment changes, and repair becomes more difficult. The anti-aging effects of preventing this line formation by not mashing our faces into a pillow can be remarkable. So what is the solution? Well, there are only two ways to prevent the development of sleep lines and wrinkles. Recently, the American Academy of Dermatology said, sleep on your back to prevent these sleep lines. Or, sleep with the Envy pillow every night. Envy's unique patented design allows us to sleep on our side or back in perfect alignment without putting any pressure on our delicate faces. Further to preventing wrinkles, Envy is the perfect post-procedure tool after facial filler, as well as an essential post-plastic surgery aid. Sleeping with an Envy pillow gives us peace of mind, knowing that our sleeping position will not harm our healing skin and tissue. The top picture demonstrates facial compression on a standard pillow, and the picture below demonstrates side sleeping on a specialty anti-aging formed pillow, Envy, which minimizes the face-to-pillow contact. The Envy pillow allows us to receive that much-needed restorative sleep on our backs or on our side, with our faces slightly tilted away from the pillow. The sleep lines in the first picture fade quite quickly after a few nights of off-your-face sleeping on Envy, the anti-wrinkle pillow. Sunblock, night serums, and Botox injections are common anti-aging tools. However, not enough attention has been given to correcting sleep positions in preventing premature aging, specifically sleep lines. A well-known anti-aging specialist in the U.S. has said, "For years we have educated clients on the need for SPF to protect against premature aging related to the sun. It is time we educated our clients on the effects side sleeping can have on the formation of sleep lines and the enhancement of facial asymmetry."
Be done. Our moms were definitely right when they said sleep is the key. Pillow. This is called the Envy pillow. This is an amazing product.